Have you ever wondered what it feels like to pay thousands of dollars for health insurance, only to be told, sorry, we won't cover that? Well, that's becoming an increasingly common reality for millions of Americans. This crisis, marked by a dramatic surge in insurance claim denials, has taken a tragic turn. The murder of UnitedHealthcare CEO Brian Thompson by Luigi Mangione, an Ivy League graduate from Baltimore, has thrust this issue into the national spotlight. Social media is now flooded with outrage and personal stories. As people demand accountability from insurance companies, they feel prioritize profits over lives. The numbers are shocking. In 2024, nearly 1 in 3 insurance claims are being denied, leaving countless Americans struggling to get the care they need. But here's the thing, this isn't just about numbers on a page. It's about real people facing real challenges. And we're going to share their stories with you. Think about this. You're doing everything right, paying your premiums, following the rules, seeing in-network doctors. Then suddenly, you need medical care, and your insurance company says no. It's a scenario that's playing out more frequently than ever before, and it's reshaping how Americans think about their healthcare security. Let's explore why this is happening and what it means for all of us. Let's talk about what's really going on behind these denials. Recent data from Experian shows something truly concerning. Health insurance denials jumped by 31% in just 2 years. That's not a small increase. It's a massive shift that's affecting millions of people. But what's really interesting is how these denials are happening. We're seeing insurance companies using new technologies, including AI, to review claims. While this might sound efficient, it's leading to some troubling outcomes. Here's what makes this situation even more challenging. Most people don't realize they have the right to appeal these denials. In fact, studies show that only about 10% of patients challenge these decisions. But here's the thing, for those who do appeal, many actually succeed in getting their care covered. It's like having a door slammed in your face, not realizing there's a key right in your pocket. The really frustrating part? These denials aren't just affecting optional procedures. We're talking about essential medications, necessary surgeries, and treatments that doctors have specifically prescribed. When you look at the numbers from the American Medical Association, they paint a pretty clear picture. 94% of physicians report that these denials are actually delaying patient care. That's not just an inconvenience, it's a serious healthcare issue. Let's put a face to these statistics. The frustration isn't just reflected in numbers, it's also echoed in the voices of those who've experienced these denials firsthand. To shed light on how these systems operate and why public outrage has reached a boiling point, here's a former insurance industry insider sharing their perspective.
When you look at what's happened online, were you in any way surprised at the amount of frankly, hero worship towards the man accused in this killing?
I was, because nothing like this has ever happened. So I think it took us all by surprise. I will say, though, I'm not shocked when you stop to think about the rage that people have about health insurance companies in this country. I experienced that even when I was in the industry. We knew, we being other executives, that uh, healthcare people in healthcare in this country do not like health insurance. They know that these companies are in the business to make money, and they've erected barriers that make it increasingly difficult for us to get the care that we need.
As you heard, these delays and denials are not just statistics, they're real barriers that can cost lives. Public frustration with health insurance companies stems from their systemic approach to profits over care, and this frustration is becoming increasingly vocal. Take Jen Watson's story, a 41-year-old mother from Washington state dealing with multiple chronic illnesses, including epilepsy. Her doctor found medications that could help manage her nerve pain, but her insurance plan refused to cover them. The result? She can't stand for more than 15 minutes without experiencing severe pain, making it nearly impossible to find work. This is the kind of domino effect that insurance denials can have on someone's life. Or consider Justine's case, a 51-year-old nonprofit worker who needed specialized compression sleeves after her breast cancer treatment. Even though her insurance initially approved the $4,000 equipment, they kept finding reasons not to pay, leaving her stuck in a seemingly endless loop of paperwork and phone calls. These aren't just isolated incidents. They represent a growing pattern that's affecting people from all walks of life. What makes these stories particularly powerful is how they show the ripple effects of insurance denials. We're not just talking about medical consequences. These decisions impact people's ability to work, care for their families, and maintain their quality of life. The stress of fighting with insurance companies while dealing with health issues creates a burden that many find overwhelming. Now, let's peek behind the curtain and understand how the system actually works. Insurance companies have increasingly turned to something called prior authorization. Basically, they want to approve medical services before they happen. Sounds reasonable, right? But here's where things get complicated. The number of these prior authorization requests jumped from 37 million in 2019 to 46 million in 2022. That's a lot of paperwork and a lot of waiting. What's really interesting is how different insurance companies handle these requests. Some companies deny as many as 13% of prior authorizations, while others only deny about 4%. That's a pretty big difference, and it raises some important questions about consistency and fairness. But here's what's really concerning. When doctors were surveyed, 78% said these delays sometimes led to patients simply giving up on treatment altogether. The process has become so complex that even professional patient advocates are struggling. The Patient Advocate Foundation reports that resolving a single case now requires an average of 27 phone calls or emails, up from 16 just a few years ago. It's like the system is becoming more complicated just when people need it to be simpler. Here's where things get even more challenging. While insurance denials are going up, so are the costs of everything else in healthcare. The average family health insurance premium now costs over $25,000 per year. That's like buying a new car every year just to have health coverage. And even with this expensive insurance, people are paying more out of pocket than ever before. The deductibles, that's the amount you pay before insurance kicks in, have shot up too. The average family deductible increased from $2,500 in 2013 to $3,700 in 2023. When you combine these rising costs with the increasing likelihood of having claims denied, you start to understand why medical debt has become the leading cause of bankruptcy in America. What makes this situation particularly frustrating is that while families are struggling to afford care and fighting to get claims approved, insurance companies are seeing record profits. The stock prices of major insurers have nearly doubled over the past 5 years. It's creating a situation where people are paying more but feeling like they're getting less in return. So, where do we go from here? While the situation might seem overwhelming, there are some important things everyone should know. First, always appeal a denial. Remember that statistic about how few people actually challenge these decisions. Those who do appeal often succeed in getting their care covered. It's like having a superpower that most people don't know they possess. The landscape is also starting to shift. There's growing pressure for more transparency in the denial process, especially when it comes to AI-driven decisions. Some states are introducing new regulations to protect patients, and there's increasing scrutiny of insurance company practices at the federal level. We're also seeing new tools emerge to help people fight back, like AI-powered services that help craft appeal letters. The most important thing to remember is that you're not alone in this struggle. From support groups to patient advocacy organizations, there are resources available to help navigate these challenges. And while the system might seem intimidating, understanding your rights and knowing how to advocate for yourself can make a real difference. Lastly, as we wrap up this deep dive into America's insurance denial crisis, it's clear that this isn't just a healthcare issue. It's a human issue that affects millions of families every day. The combination of rising denials, increasing costs, and complex appeals processes has created a perfect storm that's challenging our entire healthcare system. But remember, knowledge is power. Understanding how these denials work, knowing your right to appeal, and being prepared to advocate for yourself can make a real difference. While the system might be complex, you don't have to navigate it alone. Together, we can work toward a healthcare system that actually works for everyone. Thanks for joining us on this exploration of one of healthcare's most pressing challenges. Don't forget to like and subscribe for more in-depth looks at the issues that matter to all of us. And let us know in the comments. Have you experienced insurance denials? How did you handle them? Your stories help others know they're not alone in this struggle. Thanks for watching, and we will see you in the next one.